and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone, and welcome to the May 4th edition, Shawnee County Board of County Commissioners. Today, I have Commissioner Aaron Mays, who represents District 3 on my left, and on my right is Commissioner Kevin Cook, who represents District 2, and I'm Bill Rippon, and I represent District 3.
Good morning.
Good morning. That was just okay.
Need a larger crowd.
We do need a larger crowd.
That's, I'm not right now, but just, that makes the volume, unless Jim wants to be really, really loud. He doesn't want to today.
A lot of our participants today have phoned in and they're able to hear our conversation and talk to us. What's first on the agenda?
First item is item 3, consent agenda.
I would move to approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business, A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have 2 voucher reports as we're still having the alternating meetings. As we go back to having regular meetings twice a week, we'll just have 1 voucher report per meeting. But the first voucher we have is from April 29th, and that was for $1,016,275.96. The highlights out of that voucher report was the JADO expenditure for $605,145.23. There was the coroner's office for $47,316.67. Holding accounts for the state of Kansas, $42,598.34. Finally, highlighted under equipment fund was MCON for $33,750, and that was for the Adventure Cove improvements. The second voucher was from May the 1st, and that was $951,297.71. The highlight out of that really is in 3 categories. The first is payroll, which was $534,159.98, and then holding accounts with the state of Kansas for $87,682.74, and our health insurance premiums of $145,011.63. I do not have any questions regarding either voucher report and would move for the approval of both.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I'll move that the correction orders be approved.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Health Department number 1, consider authorization and execution of contract C-173-2020, Memorandum of Understanding with Grace Med Health Clinic, Inc. for record abstraction by the Fetal Infant Mortality Review Program with no cost to the county.
Good morning, Commissioners. Linda Oaks from the Health Department. I'm very pleased to be here to talk about 3 things that have nothing to do with COVID-19. So back to some regular work. This first agreement is an agreement with Grace Med to do record abstraction for our Fetal Infant Mortality Review Program. You might remember that is a program where we do record reviews and interviews with parents who have lost infants or had a fetal death, and we compile that information, and then we have a review team that looks at the data and sees if we have any trends in infant or fetal deaths, then makes recommendations. And so, and the recommendations go to one of the work groups in Heartland Healthy Neighborhoods, and our Safe Sleep baby showers are a result of some of those recommendations. And I will say we're planning on doing that virtually this year, so we will still have the Safe Sleep baby shower and have those pack and plays available for parents who need safe sleep equipment. So I'd be happy to answer any questions about this agreement.
Any questions?
I move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B2, consider authorization and execution of contract C-174-2020, Addendum 2 to the agreement with the Kansas Department of Health and Environment, Division of Health Care and Finance for grant funding in the amount of $536,000 for outreach, prevention, and early intervention services with dollar-for-dollar matching funds from the Early Childhood Block Grant.
Linda Oaks from the Health Department again. This is our second year of this cycle of agreements. We've been doing this program for many years. Medicaid gives us dollars to use for early intervention programs. Some of this money, and more than half, $536,000 goes to the Health Department for our Nurse Family Partnership Program, which is our evidence-based early intervention program, and $360,000 goes to Kansas Children's Service League to help fund their Healthy Families Topeka program. And then it is matched by the Early Childhood Block Grant funding. So this has been a very successful program, and we're happy to be able to get these dollars into our community. It is only available to health departments. That's why we use some of it for our health department, and we pass through some of the money to the Kansas Children's Service League. And I'd be happy to answer any questions about this agreement.
Questions?
Move for approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 3, consider authorization and execution of contract C-175-2020 with the KDHE Bureau of Epidemiology and Public Health Information for funding in an amount of $3,000, how you wish, $3,000 for the mosquito surveillance program Brian would have liked that. For the mosquito surveillance program in Shawnee County from May 31, 2020 through September 19, 2020.
Linda Oaks from the Health Department again. I don't know if I could spend $3 million on mosquito surveillance, but I could try. So this program is, once again, excuse me, we are partnering with Kansas Department of Health and Environment to provide mosquito surveillance for Shawnee County. Mosquitoes are going to come back, unfortunately. We're still going to have to deal with West Nile, and so we want to make sure we're doing that surveillance. Our environmental health staff do set the traps and bring them in and send them to University of Kansas for the analysis, and they enjoy doing this work. So I'm excited to be able to do this again and see what mosquitoes are doing for us. And with all the rain we're having again, we may have more mosquitoes again this year. So be happy to answer any questions about this agreement.
Questions? I always look forward to Craig Barnes' report on mosquitoes.
I'll let him know.
Thank you. I'll move that we approve.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Linda.
Thank you, Commissioner.
Next item.
Item C, Public Works. Number 1, consider approval of request for a project budget of $518,000 for the replacement of the Northwest Wilson Road Bridge over a tributary to Half-Day Creek in 2020 with funding from the countywide half-cent sales tax bridges.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. Yes, we want to replace this Wilson Road Bridge. We've talked about it a couple times before. It's located 2 miles west of Topeka Boulevard on Wilson Road, about 360 feet south of the Jefferson-Shawnee County line. Looks like we're going to let that project in early 2021. We're going to replace a bridge. That bridge, if you recall, had those encased steel beams. It has a 16.3-foot wide roadway. We're going to replace it with something that has a 28-foot roadway. Looks like it's going to be a rigid frame box culvert of some sort, so the hub guards will be well outside the clear zone, so we shouldn't require any guard fence. The project budget is for approximately or exactly $518,000. This money will come out of the 1/2 cent sales tax. And with that, I'll take your questions.
With the concrete box culvert operation, how much, if any, of this can we construct in-house, or is it going to be all order and precast and delivered?
I don't really like precast box culverts because with precast you have a lot of joints. And I've found in my career that joints, whether you're talking pavement or structures, are a weak link. So I think this is something we'll cast in place. It's way too much project for our internal maintenance people. So again, we would let this project to a contractor and 100% of that work would be performed by a contractor.
Now, would they form it on site, or would they bring it in and then deliver it?
They would form it on site.
Any questions?
So
Move to approve.
let me add, please, the significance of that is the road will be closed.
How long do you think the whole project would take?
Oh, I'm hoping no more than 100 days, but we haven't established that yet. When that's known, probably when we notify the public, that information will all be known, and we'll provide that information.
Fairly easy detour.
Yeah, there's detour roads up there. Yeah, that shouldn't be a problem for the locals that know the area. You bet.
What's your pleasure?
Yeah, I'd move to approve.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioners.
Sure. Next item.
Item 5, Administrative Communications.
Good morning, Commissioners. Ironman, Shawnee County Emergency Management. I'm sure that most of you are aware, just wanted to give you another heads up. We are in a severe thunderstorm warning that was just extended until 10 o'clock this morning. Most of it is heavy wind and hail, so please have your preparedness plans in place. Be ready to take shelter at any given moment if you need to. We'll let you know what's going on. If you have any questions, be more than happy to answer them. Thank you.
Good morning, Commissioners. Dusty Nichols, Incident Command for COVID Response, Shawnee County. Just want to go over a couple things. As you know, yesterday we put in an addendum to the governor's order that we have adopted for Shawnee County, and we're trying not to add any additional restrictions. But as we come back online, we're getting phone calls and questions. So I had to put an addendum out yesterday to clarify some things like the counter rule, for example. People can order at the counter, take their food to a table, but you can't eat at a bar type where the bar stools are. That's out. That's the counter service we're talking about. So this next couple things I just want to kind of go over, and we're going to be putting another message out. I'm going to try to do daily addendums to answer these questions and try to get out before noon. So I really need the media's help. Please help us get this message out. There's some responsibilities that businesses have, of course, to the community, and making sure we're doing social distancing as much as possible to include all those restrictions that are in there. But if they want to take that extra step, that's good. We really appreciate that, and I think the community will as well. Just because a business can open doesn't mean they're going to. We're not restricting that right now with few exceptions. So if the business decides not to open, that's up to them. And we are still encouraging people to stay home, especially if they're in a high-risk category. We're encouraging and highly suggesting people wear masks. Again, a lot of that is you're protecting the person that you're talking to or around. It doesn't necessarily protect you. So we really encourage that. So the business responsibilities, I think they're taking it very seriously from what I'm hearing. But there's also that level of personal responsibility, wearing a mask to protect others. That's a big key. Observing people's personal space, doing that 6-foot distancing wherever you're at, whether it's a store or a restaurant, be cognizant of that. So again, that's just helping community partners and helping community people in your community, and just respecting their personal space and just being good citizens with each other. So the other thing I want to talk about, and this is what we're really, really, really trying to get out this week, is personal risk assessment. It's up to you as an individual to take that responsibility upon yourself to decide whether you're going to go in or going to partake in this. If you choose not to, that's fine. We encourage people to stay home, but if you go to a parking lot and it's crammed full and you know what to expect going in, maybe you make that choice not to. We can't make those decisions for every single person in the county, as you know. So we encourage personal risk assessment. We'll get some more information about that, but that is going to be key for us going forward. We're expecting to see numbers go up. We're expecting to see these things happen. We just want to get well. We want to get well. We want to get our economy back open. And part of that responsibility relies on every single person in our community to try to do the right thing to themselves. Don't get yourself sick. I will try to put out a daily addendum To clarify a few things, which I'm going to do right now, and these will be coming out at noon. The Topeka Shawnee County Public Library, they are not going to open until Phase 2, and they're working on their plan to reopen. And it may not be in Phase 2. Again, I want to say these dates are good planning dates, but don't rely on those dates to be exactly right. We could come, the governor can come down and say you can't go to Phase 2 yet. So we are watching that. So just use those dates as planning tentative dates. So Topeka Shawnee County Public Library is not going to open until at least Phase 2, whenever that date is. Rossville is going to remain closed through May 18th, Rossville Public Library. And the Silver Lake Library is going to remain closed through May 25th. And when they do open, it's going to be limited services. Those will be on the addendum coming out today. I also want to talk about a couple things that we got a lot of calls on. I got a lot of videos from this, and I'm hoping we don't have to engage any further than me discussing this right now. Goes back to those personal responsibility, business responsibility, event responsibilities. If you're inviting people to come out during this phase, for whatever reason, I'm highly encouraging you to not do that. I'm talking about car shows. I'm talking about gaming nights. I'm talking about anything that puts people or brings people out and puts them in a social situation. Please don't do that. That's not helping what we're trying to accomplish, and we're trying to get better. Leisure spaces are defined in the governor's order as just a general term. So I'll be clarifying. Leisure spaces are those places like we have here, the axe throwing, the lock-in rooms, gaming situations. Those are not allowed right now. Those invite social situations that we're trying to avoid, at least in Phase 1. Also, the art, the potteries, the painting, all those kind of things. If you're bringing people in and you're sitting around, please think about what you're doing here. So I'm hoping those businesses take that responsibility and just hold off a little longer if they can. So we consider those leisure spaces, and I'll be clarifying that with the state today if that qualifies, and then if it does, I'll be defining that in the addendum today or as soon as I can. So please take care of yourselves, take care of each other. We're at a critical week this week. We're trying to open stuff up, and you heard Linda talk, or we'll be talking a little bit more about those numbers and what we really got to be careful on. So please support your community as individuals, support your community as businesses. We want to get better. So I can stand for questions.
No, thank you.
Thank you very much.
Thank you. Thank you.
Good morning, Commissioners. Linda Oaks from the Health Department. I do want to bring up our dashboard, see if it's been updated this morning yet. Our staff had kind of a long weekend, so not quite yet. So we really do have 127 cases. We had one more case added yesterday. So these are our numbers for right now. And then one thing I wanted to point out about this is that we are breaking the cases down by gender, by ethnicity, by race, and by age. So I know people have been wanting that, so we do have that now on our dashboard. I also want to talk about last week we had 24 new confirmed cases. The week before we had 10, and we weren't open yet. So I am concerned about the uptick in cases last week, and at least one person was hospitalized. So we had more than double the amount of confirmed positive cases from the previous week. So we know this virus is in the community. It's spreading in the community. We know we had some cases that we couldn't identify where they were exposed, so that's always concerning because that means we have community transmission. So I just want to stress again what Dusty said, that people need to stay home if they're in the high-risk groups, that use the social distancing, stay 6 feet apart. There should not be the social gatherings right now. When you think about if we had large groups getting together and we had cases, it would be a nightmare to try to do all those contact tracings. We couldn't keep up, which is why we're keeping the groups to 10 right now. So we are keeping up right now. I still have at least 8 nurses working on these contact tracings that really have other jobs. And so eventually I'm going to have to move them back to their other jobs, so we're going to have to make some long-term plans on how we're going to continue the work. I'm in conversations with KDHE about how they can help. We should get the Academy of Science software that you approved last week. We should be able to get that up this week and running. So we're making plans for the long term, but I'm also concerned about the short term. So that is all I have today. We know we're going to see some more cases. As Dusty said, we don't want to see a ton more cases. And we certainly don't want to see more people hospitalized or become very, very ill. So I'd be happy to stand for questions.
Linda, in terms of the contact tracing, if we do have an uptick, and I know you said your staff probably wouldn't be able to keep up, but don't we have a medical reserve corps of volunteers that we could use perhaps?
We do, and we are using some of those volunteers.
Okay.
It's a tough thing to do, and you have to so not every nurse wants to call people and say, hey, you have this virus, and by the way, I need to know everybody you were around and every place you were for the last however many days.
Yeah.
And then when we get employers and those situations, corrections as of like the Topeka Correctional Facility, those kind of cases, then it gets really complicated. So if people are asked to be in quarantine, and they do, and they stay in quarantine, they become ill, that's easy. They don't have any contacts, so we can take care of that very easily. So I think that's why I keep stressing. I know that's why I keep stressing. If you're asked to be in quarantine, you're told to be in quarantine, stay in quarantine so we can stop this transmission, and we can do that. So sometimes they're difficult and sometimes they're not. It just depends. And then not everybody cooperates either. So that's always difficult.
One more question.
Sure.
Obviously the active cases has gone up quite a bit, but it appears that the deaths has remained at 5 for quite some time. Is that, when was the last time we had anyone die from this here?
It's been at least 2 to 3 weeks.
Do you think that's a result of just improvement in the way that they're treating it at the hospitals, or luck?
Yeah, I probably a combination of all the above. I don't really know. It is interesting to me why some areas of the country have seen a lot of deaths and some have not. So we've been, I want to knock on wood for this one.
Right.
We've been very fortunate. We've not had an outbreak in a nursing home yet. I think it will happen. But our nursing homes are doing a great job of working with us and getting together with us when there's been like single cases, but we've gotten on top of it and been able to contain it. But there's some facilities that are going to have a very hard time. I think especially the memory care places. It's going to be really tough to contain it there. So I'm just kind of on the edge on that. I'm really nervous about nursing homes. And I think because we haven't had the nursing home outbreaks yet, our deaths are down too.
All right, thank you.
Mm-hmm.
Linda, would it be possible on the dashboard to show how many people are actually hospitalized at any given time?
I can ask. I don't know.
I know we have 28 active cases right now. Do you have any idea how many are being hospitalized right now?
I know of one for sure. I don't know. So let me say this. I know the hospitals have more than one person with COVID-19, but they're not all from our county. So that's what's tricky too about the hospitals is that those are regional hospitals.
Yeah, well, I know one of our reasons for doing what we're doing is not to overload the medical community, and it appears we haven't done that yet.
I would say so far we have not done that.
And we've tested over 3,000 people,
Yes.
and we've had 126 cases. That's like 4%. Of that 4%, of the 126, how many of those do you think were hospitalized?
I just don't know off the top of my head. I'm sorry, because we don't always know. They're in and out pretty fast sometimes. There's just a lot of variables on that. I know we've had some, but not a great number.
I think there's such a real fear out there. People think, if they get this, that they're going to be in the hospital or they're going to die or whatever, and that those numbers just don't reflect that.
Most people that get this virus will recover, but we're concerned about the people, especially in those high-risk groups. Their death rates are much higher than the rest of the population.
Do we know much about the 5 who have died? Did they have other pre-existing conditions that?
I believe that they all had risk factors that contributed, yes.
When we report death, if they have it at all, do they consider that they died because of the virus, or?
You know, that, I can't answer that one. It's up to the doctor, the attending physician, to put down the cause of death.
Maybe I read too many things at night, but anyway, I hear a lot of cases where people, they attributed their death to the virus, but then, you know, they had heart trouble, they had a weight problem, they had diabetes, or whatever, they had a lot of other contributing factors. And I think some people, they didn't die of it, but they died with it, and you know what I'm saying? And I don't see consistency in how people report it from one country to the other, and even probably from one state to another. So, all right.
That's some of the problems with a brand-new virus. We say at our office that we're building this plane while we fly it.
Mr. Chairman.
Yes.
Linda, on the 116 people that we're monitoring,
Mhm.
those are people that have been tested but have not yet been.
No, the people that are being monitored are contacts to active cases.
Okay.
So the tests, the pending tests are 37. However, that's KDHE labs. So the private labs, we usually don't know about those tests until they report positive or negative. So there's more pending tests out there than that.
Okay. Now, on the hospitalization, we may see some people with a short hospitalization stay, some with a longer hospitalization stay, so it's not a way of saying for certain who's going to be in a hospital for how length?
Right.
And isn't that the concern with not knowing where we may be quickly overloaded with our hospital beds?
That is one of the big concerns, yes. And so that's why we're opening at small increments so we can handle whatever comes our way. Because more people will get this virus. We can't stop that.
Can we go down to the demographics?
Sure.
So now that we have that prepared, and if we had our,
Is that where you want it?
yeah, what is it that we can tell now? I know this data is very early and very new, but what sorts of things should we draw from this, or what can we draw from this as a community?
I think one of the areas that I am concerned about, of course, is the Black or African American. So of the confirmed cases, 29% are Black or African American. That's quite a bit higher than our population here in Shawnee County of Black or African American. I believe it's around 12 or 13%. So that is concerning to me that that group is getting hit harder than whites or the other categories that we have here. So gender, I think it's interesting. I've heard nationally that it hits more with men, but here that's not really the case. But again, our numbers are smaller. So, and then ethnicity, I don't know how that compares to it's probably pretty close. 16% are Hispanic or Latino to our population.
And if I look at the age,
Mm-hmm.
are we really seeing in Shawnee County something that's different than what we may be hearing on a national news feed, that our highest number is coming from a much younger age demographic?
I don't know the answer to that question. I mean, that is interesting. We are seeing that higher number right now. But again, no nursing homes yet. So that will skew that if we do end up with outbreaks in nursing homes.
And it just seems to be a different story narrative than what we're hearing on a national news feed.
Yes.
Because they talk about a higher age demographic, and this is showing a lower age demographic for Shawnee County.
So is it different, or are we just behind? I don't know. Any other questions?
Right,
Yes,
real quick.
Sure.
So there was a news story came out maybe a week ago about how the governor had procured 500,000 more tests. Is there any indication as to whether or not we're going to receive any of those to do some maybe community testing, like a little bit more widespread, not so targeted as what we've been doing?
I do believe we can get some of those tests, and we are making some plans right now, just not quite ready to announce when we'll start.
Okay.
But yes, we are getting prepared to do some testing through the health department. Right now, the hospitals are still keeping up with the number of tests that we need to do. So people that are sick can get a test. They just need to call.
Linda, currently, we're just testing people that have symptoms, is that what we're
Yes.
doing? But there hasn't been any like random sampling of testing just to the general populations?
Not yet, not here.
Okay. Would that be part of future tests?
I think it could be. I think, again, I'm going to go by the guidance of what Dr. Pizzino recommends plus KDHE. They have not recommended that yet for Kansas. So.
It seems like if you did a more random test, it might give us a good picture of where we are.
The test is limited. Dr. Pizzino's talked about that. You have to have the virus in your throat for the test to pick it up. So it is somewhat limited as what we can tell But it could show us some asymptomatic folks, which we know we have some.
I know in Dodge City, they had a lot of people that were asymptomatic.
But they can still spread it, so. Mhm.
What are the odds that everybody will come in contact with this virus at some point in time? I mean, you can hide all you want. You can
Yeah,
run,
right.
but you can't hide. You know what I mean? And at some point, will you come in contact with it?
You know, probably. I mean, I don't know the answer to that so much. I'm thinking about for myself. So I'm going to try to hold out till there's a vaccine. That's my goal, is to not come down with this. Now, will I make it? I don't know. I'm being very careful. And so again, it goes back to that personal risk assessment that Dusty is standing behind me to talk. So I didn't know you were back there. So it goes back to that. I mean, I think probably I have a pretty good chance of ducking it until there's a vaccine. I know my dad says that too. I'm staying right here until there's a vaccine in his apartment. Good for him.
Any other questions?
Okay.
Thank
Did you
you.
want to say something about that? You want me to pull this down?
I just wanted to kind of touch on something real quick. I know we get hyper-focused on what we're dealing with as far as COVID specifically, but there are other threats that are still remaining, not just besides the weather. We're seeing domestic violence go up and all those kinds of things that we need to keep in mind. And when we're looking at the totality of the situation here, when we're talking about overwhelming hospitals, again, we're really focused on keeping the resources going, make sure they have all the stuff that they need. And right now, it's pretty evident that they're doing good on PPE because they're starting to open their clinics. So I don't want people to think just because COVID patients are not in a hospital, we're not overwhelming that system. They're still going to have PPE requirements. They're still going to have all these things that they need to do. So the one hyper-focused look at this, just looking at the COVID side of this, doesn't mean that we're not going to overwhelm the hospitals. I just want to think about that, keep that in perspective, because that's what we're looking at across the board as they open clinics. Those PPE that they're good on right now, if we get a quick spike in hospitalizations with the COVID or any other reason, we can overwhelm for a lot of different reasons. So I just want to keep that people's minds.
Courtney House, Director of Public Works. I just wanted to announce to the public that on Thursday, this coming Thursday, Southeast 29th Street will be closed from 6:30 a.m. to 6:30 p.m. to put in 2 crossroad storm sewer pipes. Want to assure the public that local access to business will be maintained. You'll be able to get access either from California or from Croco Road, but through traffic will not be allowed just for that short time period. Thank you.
Good morning, Commissioners. Larry Moss, Shawnee County Treasurer. It's that time of year, and even a pandemic can't keep me from coming to the podium and reminding you to pay your taxes. Tax day is on May the 10th. Because that falls on Sunday, it's effectively May the 11th. Please understand that that's the normal tax date, that the deferment of taxes was for income tax, not property and personal tax. So May the 11th, your taxes are due. The office remains closed, so you have 3 options for paying your taxes. You can pay online, you can pay by mail, or you can drop off. We have a drop-off box at the west exit of the courthouse parking lot. A bit of good news, as of today, our tax receipts look normal. So I'm assuming that when we finish out the week that we will have collected the normal amount of taxes that you would expect. I would take this opportunity to thank the taxpayers for being diligent in paying their taxes, even under the circumstances that we're under. The 49 entities that these taxes will be distributed to in June need this money to pay current expenses. So thank you again to the taxpayers for paying your taxes. On the motor vehicle side, I opened the annex to appointments only today. I emphasize it's appointments only. We have a backlog of about 20,000 people who are past due and need to come in and see us, and that will only grow by about 20,000 each month because we're going to get into our busy months. So you can imagine if everyone decides just to show up and take their chances, that's going to be quite a mess. So please, appointments only. It's very easy to do. Just go out onto the Shawnee County website. There are links there to take you over to get an appointment. If you get an appointment, we will require that you wear a mask to have access to the office, and we would ask that you bring your own pencil or pen so that we don't have to share the pencils and pens with you. I would be glad to answer any questions you might have.
Mr. Chairman, any questions? You know, Larry, today is Star Wars Day, May the 4th. I thought maybe you were going to bring your Darth Vader mask instead of your K-State.
I do have a Batman mask, but
Yeah.
my K-State mask rules.
So for the property taxes, since there is no delay in when property taxes are due, if a person is unable to make that tax payment, what happens next? Is there automatically goes into foreclosure? Is there a penalty? Do you get thrown in the newspaper for everybody to make fun of? I mean, notice. What happens?
Well, we do have statutes that lay out specifically what needs to happen. The first thing that happens starting May 12th, we start charging interest. That interest rate is set by the state of Kansas and is dependent on how much you owe. So you'll owe interest. The second thing will happen if you are still delinquent by the end of July 31st, then law requires that we print your name in the newspaper for 3 consecutive weeks, and we will charge you $17 as a penalty. That's the expense for printing that. It's required by law. So that's our notice of shame, if you will. Now, as far as losing your property, the entire process to go to foreclosure and a tax sale takes approximately 2 years at the very soonest. So you are not going to see an officer at your door with a U-Haul truck to tell you to get out because we're selling your property. That's at least a 2-year process, more like 3 in reality. So you have time. Now, one of the things that we do offer is that you can make a partial payment. So if you can make small payments rather than one large payment, do so. The outstanding amount is still subject to interest by law. However, we will take those partial payments.
How much is the interest? Do you know? Just where it ranges from?
Well, it went up this year to about 10%. So it's pretty stiff. For years, we were in the 1%, but depending on how much you actually owe, the total amount, it can be as high as 10%.
But for a person whose total taxes are $2,000, you're talking about a $200 penalty.
Yeah, but that's per day, so spread that over. That's a 200 penalty if you're plus $17 if you're a full year and you haven't paid a dime.
And then, do you have any ability? You have no ability to abate that or reduce that. It's all set by statute.
Yes, it is. In fact, no elected official in the state of Kansas has the ability to forgive those penalties unless it's a very unusual circumstance, and I don't even know what that circumstance would be. It's written into the statutes. We have AG's opinion. I and no other elected official can defer or reduce those penalties. Now, there's some things that can happen if you appeal. That's a different situation. If you appeal and you go through the appeal process, those things can get abated. But as far as just doing it out of the goodness of our hearts or because we think you deserve it, we are legally required not to do that for obvious reasons. Real conflict of interest there.
Now, if a person has a new vehicle that they've purchased in the last 30 to 45 days or 60 days, their 60 tag is expired, they make an appointment with your office now that it's open to process new tags, or?
They can make an appointment with our office. The 60-day tag has actually been extended to 60 days after the order expires, which is due to expire on May 18th, which pushes you out to July. Obviously, you don't want to wait till July 18th because you're going to be in the boat with about 40,000 other people. So we do offer another option that we've created, and that is to do it by mail or drop-off. If you go out on the website to make an appointment, you'll also see a link there to click on, and we will send you a packet which shows you how to actually do your titles by mail or drop-off. We've also provided that packet to local dealerships, and they have been giving those to new customers. We've completed about 500 in that manner. It's a little bit awkward, but we're starting to smooth that out. So you can do that remotely without ever coming into the office and exposing yourself or anyone else. And it's a packet. It's very self-explanatory, and most people can do that. We'll email that to you. You can print it out and drop your documents off. And with the exception of the title, which we need the original of the title, everything else could be sent to us by images on email. And then all we need to do is get that title. We'll call and arrange for the payment over the phone. You can pay by check or credit card.
Okay. Thank you.
Okay, thank you.
Blair? Anyone else? Commissioner Mays, do you have any?
Nothing from me.
Commissioner
See,
Cook? Oh, we have another. I'm sorry.
One more thing, Airman, Emergency Management. There have been reports of some fairly severe weather out west around the Wanamaker Corridor and then southwest K4 Highway and Glick Road. We believe there might have been a microburst. However, deputies and people out in the area have not seen any rotation. But once again, just be prepared. Thank you.
thank you. 1984 marked the first week of the National Correctional Officers Employee Week. This is a recognition of the entire legal for the correctional officers community to recognize everything that they do. And so likewise, as a county commissioner for Shawnee County, I would like for the county commission to recognize our Correctional Officers Week for all that the Department of Corrections does for Shawnee County. These are employees that are there regardless of what the virus or world circumstances may be. They're the ones that are making sure that the inmates, whether they're there having been found guilty or awaiting trial, are treated justly and fairly and receive services. And so I'd like to take an opportunity to thank the correctional officers, the Shawnee County Department of Corrections, and recognize the National Correctional Officers Week for this week.
Very
Thank
much.
you.
Very good. Anything else?
No, that's it.
Well, I just want to say, we've entered a new phase now. We're still under the governor's order. I wanted to let people know that we can make the governor's order more restrictive, but not less restrictive. At this point, it's not Shawnee County or the commission or our emergency preparedness that's making those calls exactly. We're under the state's order, so we're following that. I know there's some confusion out there. I get a lot of emails from people saying, open up businesses. Well, I can't just say, everybody can be open. We still have to follow the order. But having said that, a lot of new businesses will be opening up today. Use common sense when you go to those businesses, but do support our local businesses. We can't let our economy fail. We need to get out there and support these people. It's critical, but use common sense. And that's all I have. Do we have a need for executive session?
I don't.
We're adjourned then. Thank you very much.
Just, I do. I'm sorry, I have a resolution.